There's a poetry to good deeds that empower social change, often lost and forgotten by following generations. If you're under 40, then you've never known a world without the safety of childhood vaccines. And you probably don't know that the top killers of children in the 20th century were beaten by science, public health, and two first ladies from the genteel South, Betty Bumpers and Rosalyn Carter. Nowadays, it's hard to imagine life at the height of the polio epidemic in 1952, when nearly 60,000 cases and over 3,000 deaths were reported in the United States. Those who didn't die were often sentenced to life in an iron lung like this one, used by Arkansas polio survivor Peggy McCormick.
You go to the hospital to visit relatives or something, you'd see children in these iron lungs, and adults pretty often too. But it was just a horrible, horrible thing.
And then came Jonas Salk, Albert Sabin, and polio vaccines.
One of the happiest days of our lives as parents was the day we could go to the local school and swallow the sugar cube. And I was teaching school at the time, and the year before, 5 children in that small school, because we lived in a small town, had polio. So that was the one thing that I guess it motivated me and made me come to the full realization what a wonderful thing that immunizations were.
And back then, everybody in town had to go. I remember these long lines at the schoolhouse, and we had our vaccine on a sugar cube. And that was a scary time because everybody was afraid they were going to develop polio, and it was on the news constantly. And back then, I feel like when I was growing up, when I was having my children, that everybody took them for immunizations. And I thought it was so great that now they had developed the vaccinations that would prevent these diseases that I had, because I had measles and chicken pox and whooping cough.
As a health officer for the PTA, we did clinics, twice a year in the school, seeing that we had preschool clinics and that all children would be fully immunized.
By 1970, the vaccine schedule called for shots preventing 8 different diseases, beginning at 2 months of age. The problem was that parents didn't follow the schedule or even know about it, and doctors didn't enforce it. In fact, no one did. If only there was an advocate. Then, 1971 found new governors in Arkansas and Georgia.
Our husbands were elected governors at the same time. The Centers for Disease Control came around to see all first ladies and said, we have 3 new vaccines, and we would like for you to help educate the people of Arkansas to the fact that we have these new vaccines and raise the levels of immunizations. Well, of course, I became defensive about thinking we needed to educate our people, that they were an ignorant bunch of hillbillies. So I said, if our children need to be immunized, I will work to see that they get immunized, but they don't need any more education. And I had to come up with some idea of how we were going to immunize our state's children. So being reared on a farm, and at the age that I am, I somehow began to think about who had solved a lot of our problems, and it was agricultural extension people and the public health nurse. It's the most extensive organization in this country. It's in every county of every state. And I just toured the state making speeches and talking about it and putting together these county committees. And on one Saturday, we immunized 350,000 children.
When Jim was governor, of course, I had always gotten my children involved and immunized, and knew that it was the right thing to do. And then I went to governor's conferences with Jimmy. And the governor's wives always got together, and we talked about what we were doing. And Betty Bumpers was working on immunization, and she was very convincing. at that first meeting. I thought, well, I could go home and work on immunization. But I came home and found out that everybody was not getting the vaccines they needed. And she devised a program working with the Centers for Disease Control. And I think she talked a lot of us governors' wives, spouses, to get involved. I know I did, and she came to Georgia and helped me.
In 1975, Governor Bumpers moved to Washington, D.C. to begin a 24-year career as Senator Bumpers. Betty was right there promoting her own causes.
I have two passions in my life. One of them is immunizations and the other is peace. I was busy trying to make my Arkansas model of using local, state, federal organizations and agencies to accomplish that immunization victory that we had in Arkansas. And I was trying to get that accepted as a national model.
When we got to the White House, we'd been there about 2 weeks when Betty called because her husband was elected senator before Jimmy was elected president. She'd been in Washington for a couple of years. And she called and said, let's work on all the immunizations.
She said a lot of times, I was the first person that knocked on the door, White House door to come see her, and I wanted her to help me with getting this immunization done.
When Jimmy was elected, very few states required immunization by school age. I was shocked, and so we went to work.
And work they did. The dynamic duo of immunization traveled the country advocating for childhood immunizations. And, like good poetry, the timing all came together to change the health of a nation. Public health and parents, nurses and doctors, community and private resources all joined the movement to immunize every child.
And we were able to get immunizations required at school age in all 50 states when Jim was president. I was really proud of that.
We do have the medical facilities to immunize all children in this country. Rosa and I are both very proud of that, having helped set that system into place. I think that's the thing I'm proudest of, that we have made the facilities available to everyone.
I think the Centers for Disease Control has said in the past that the immunizations required by school age was the most successful program they had ever had.
Using school age as a milestone made so much sense, ensured classroom health, and worked so well that parents actually began to confuse entry requirements with health recommendations.
So many people began to think that they didn't have to immunize their babies until they started school.
By shifting people's thinking to think you could wait until school age to immunize them was the bad thing, because that's when we set up that large group of people, of youngsters, to be vulnerable to the measles and to other childhood diseases.
Today, when young parents ask why there are so many vaccines given so soon, they usually don't know that the recommended schedule was always started as early during infancy as possible, when children are most vulnerable. And the proof became evident, as it too often does, in a preventable tragedy.
There was an epidemic it started late 89, I think, 1989 and 99. About 150 people died, and many of them were babies, not the little school children. Most school children were immunized.
The measles outbreak of 1989 became another real-world proof of the value of vaccines. While a few individuals in all age groups were affected, those hardest hit were predictably babies under 4 and adults over 20 who were from the generation before the school requirements.
So Rosalyn realized this and called me one day. She said, "What are we going to do about all these babies dying?"
One guess what they did.
This is a really personal issue for me. I get emotional about it. Having in our travels seen children who were hurt bad because they didn't get the immunizations and had the diseases, and I think with getting children off on a good start in life is the most important thing we can do.
It just had such a profound effect on me. And here I am in my old age, I tear up easily. But anyway, that's one of the things of seeing that has kept the passion alive. So I put together another organization, and we formed with the help of Dr. Faggy he was then out of, I think he was still at CDC, helped us come up with the title Every Child by Two.
We started Every Child by Two because of that epidemic. Our mission is to raise the awareness of parents about the great need to have their children immunized on time, and that immunizations are safe. And the other thing we wanted to do was to help institutionalize immunizations by age 2.
So then we took off with that, forming coalitions in all the states. And we traveled to all 50 states, sometimes more than once, trying to get governors' wives involved. And well, it's been, 30-something years that we've been involved in it together. And so it's been not only a great friendship, but a great passion that we both have had.
I get really emotional about Betty because I don't think there's anybody else I've ever worked with who works so hard and so dedicated to this issue.
Since its launch in 1991, Every Child by Two has worked to change the culture of parenting and ensure early immunizations. Now grandmothers, the first ladies of immunization, have one simple goal: no more preventable disease in our children.